If you are over the age of 60, there's a food you have almost certainly eaten your entire life without a second thought. You may even eat it regularly, believing it to be harmless or even healthy. But according to cardiac surgeons who spend their careers opening chests and repairing damaged hearts, this one food becomes dangerous for seniors when it is eaten alone. Not because the food itself is poison, and not because you've done anything wrong, but because your body no longer responds to it the way it once did. And the most unsettling part is that the damage does not announce itself. There is no immediate pain, no warning signal, no feeling that something is going wrong until one day something does. I want to be very clear from the start. This is not about panic, and it is not about taking foods away from you. This is about understanding how your body changes with age and how one very common eating habit quietly places unnecessary stress on the heart after 60. When cardiac surgeons talk privately about the patterns they see again and again in their patients, this is one of them. A food that seems innocent, eaten the wrong way, triggering a chain reaction inside an aging body that the heart has to work overtime to manage. My name is Dr. Nereta, and I have spent years studying cardiovascular health in older adults, reviewing surgical data, metabolic research, and long-term outcomes in patients over 60. One thing is absolutely clear in the research and in the operating room. The way your body handles food at 70 is not the same as it did at 40. Your heart has not failed you. Your body has not betrayed you. It has adapted to time. And the tragedy is that no one explains what that means for everyday meals. Here is something most seniors are never told plainly. After 60, several important changes occur in the body at the same time. Blood vessels naturally lose some of their elasticity. Muscles that once helped regulate blood sugar shrink. Digestion slows, insulin becomes less responsive. Blood sugar spikes last longer than they used to. None of these changes feel dramatic on their own, but together they create a perfect environment for cardiovascular stress. Cardiac surgeons see the end result of these changes, but the process often begins quietly years earlier at the breakfast table or during a seemingly harmless snack. What surprises many people is that the issue is not overeating or fast food or obvious junk. In fact, the food I am talking about is often praised as simple and wholesome. The problem is not the food itself. The problem is eating it alone. When this food is consumed without anything to slow its digestion or soften its metabolic impact, it can behave very differently in an aging body than it does in a younger one. Younger systems correct the spike quickly, older systems struggle, and the heart pays the price. Let me ask you something, and I want you to answer honestly, even if only to yourself. Have you ever eaten this food by itself? Perhaps in the morning or as a light snack, believing you were making a smart choice. Most people have, and most people have no idea what happens inside their body afterward. Within minutes, this food digests quickly and raises blood sugar. In a younger person, insulin responds efficiently and restores balance. In someone over 60, that response is slower and less precise. Sugar remains in the bloodstream longer, blood becomes thicker, inflammation increases, and the heart must work harder to move blood through vessels that are already less flexible than they used to be. This is not theory. Research consistently shows that post-meal blood sugar spikes are strongly associated with cardiovascular risk in older adults, sometimes more so than fasting blood sugar. These spikes create oxidative stress and microscopic damage to the inner lining of blood vessels. That lining is what keeps arteries smooth and resilient. Over time, repeated damage weakens it, making plaques more likely to rupture. That is exactly the type of damage cardiac surgeons encounter when a patient arrives after a heart attack or stroke, shocked that it happened without warning. What makes this particularly important is that cardiac surgeons quietly warn their own families about this habit. Not publicly, not dramatically, but in private conversations with aging parents and spouses. They do not say the food must be avoided forever. They say it should never be eaten alone. When it is paired correctly, the metabolic response changes. Blood sugar rises more slowly. Insulin has time to respond. The heart is spared unnecessary strain. The same food, two very different outcomes. Many seniors respond by saying they have eaten this food their entire life and felt fine. That reaction is understandable. Longevity, however, changes the equation. At 30, your body recovers quickly from metabolic stress. At 60, recovery takes longer. At 70 and beyond, repeated stress accumulates quietly. Cardiac surgeons do not operate on people because of one meal. They operate on people because of patterns repeated thousands of times without awareness. Several metabolic studies involving older adults have shown that meals composed of rapidly digestible carbohydrates, eaten alone, lead to prolonged blood sugar elevations. Compared to meals where those same carbohydrates are paired with protein, fiber, or healthy fat, these prolonged elevations correlate with markers of endothelial dysfunction, which means the inner surface of blood vessels is under stress. That stress is not felt, but it is measured, and it matters. So, why does no one explain this clearly? Because most nutrition advice is written for the general population, not for aging physiology. Because food guidelines change slowly, and because the difference between eating something alone versus eating it with the right companion does not sound dramatic enough to capture attention. But in medicine, small adjustments often have the greatest protective power. This is not about restriction. This is about control. You are not fragile. You are not broken. Your body is simply asking for smarter combinations. Once you understand this, meals stop feeling confusing and start feeling empowering. You begin working with your body instead of unknowingly stressing it. In the next part, I am going to reveal the specific food cardiac surgeons consistently warn seniors never to eat alone. I will explain why it is especially risky in the morning and how one simple pairing can dramatically reduce strain on the heart within minutes. I will also explain why so many health conscious seniors unknowingly sabotage their cardiovascular system every day while believing they are doing the right thing. Stay with me because once you hear this, you will immediately recognize whether this habit is quietly affecting you or someone you love. And more importantly, you will know exactly what to do about it. Now, let's talk about the food itself, because this is where most people are genuinely surprised. The food cardiac surgeons quietly warned seniors not to eat alone is fruit, and more specifically, sweet fruit eaten by itself. Bananas, apples, grapes, oranges, and even fruit juices are often seen as the ultimate healthy choice. And to be clear, fruit is not the enemy. The danger comes from eating fruit alone, especially on an empty stomach, when the aging body no longer manages sugar the way it once did. Here is why this matters so much after 60. Fruit contains natural sugars, primarily fructose and glucose. In a younger body, those sugars are absorbed and regulated quickly. Insulin responds efficiently. Muscles absorb glucose and blood sugar levels normalize. But in older adults, muscle mass is reduced, insulin sensitivity is lower, and digestion behaves differently. When fruit is eaten alone, especially first thing in the morning or as a standalone snack, the sugar enters the bloodstream rapidly without anything to slow it down. This causes a sharp rise in blood sugar, followed by a prolonged elevation that places stress on the cardiovascular system. The heart has to pump harder. Blood becomes more viscous. Inflammatory markers rise. Over time, this repeated stress damages the inner lining of blood vessels. Cardiac surgeons see this damage when they operate. They see arteries that are stiff, inflamed, and vulnerable. They see plaques that are unstable. They see the silent consequences of decades of well intentioned habits. Many seniors are told to eat fruit for energy or digestion, and that advice is not wrong. What is missing is the context. Fruit eaten with protein, healthy fat, or fiber behaves very differently in the body. Those companions slow digestion, moderate blood sugar rise, and reduce insulin demand. The heart experiences a gentler response instead of a metabolic shock. The same banana, the same apple, two entirely different outcomes depending on what accompanies it. This is especially important in the morning after an overnight fast. Insulin sensitivity is often lower in older adults, and cortisol levels are higher. Eating fruit alone at that moment creates the perfect conditions for a blood sugar surge. Many seniors notice they feel shaky, tired, or hungry again soon after, without realizing this is their cardiovascular system struggling to regain balance. The body is sending signals, but they are easy to dismiss. Research consistently shows that older adults experience higher and longer lasting glucose spikes from carbohydrate only meals than younger adults. These spikes are strongly linked to endothelial dysfunction, which is the earliest stage of cardiovascular disease. Endothelial dysfunction reduces nitric oxide availability, meaning blood vessels cannot relax properly. This increases blood pressure and strain on the heart, even in people who believe their numbers are normal. Cardiac surgeons often say the most dangerous habits are not the obvious ones. It is not the occasional indulgence that fills operating rooms. It is the quiet daily patterns that feel healthy and responsible. Eating fruit alone falls squarely into that category. It is well meaning, culturally reinforced, and rarely questioned. What makes this empowering, rather than frightening, is how simple the solution is. You do not need to eliminate fruit. You do not need to fear sugar. You need to change the way fruit enters your system. Pairing fruit with proteins such as yogurt, eggs, or nuts, or with healthy fats like nut butter, seeds, or cheese, slows digestion and stabilizes blood sugar. Fiber from whole foods further buffers the response. This simple pairing dramatically reduces cardiovascular stress within minutes of eating. Many seniors who make this adjustment notice immediate differences. They feel steadier. They experience fewer energy crashes. Hunger becomes more predictable over time. Blood sugar markers improve, inflammation decreases, and the heart experiences less daily strain. These changes are subtle but powerful, and they compound in your favor. This is why cardiac surgeons advise their own aging family members never to eat fruit alone. Not because fruit is dangerous, but because aging physiology demands smarter combinations. They understand that the heart does not fail suddenly without reason. It is worn down slowly by thousands of small stresses that seem harmless in isolation. If you have been eating fruit alone for years, this is not a mistake to regret. It is an opportunity to improve. Aging does not mean giving up foods you enjoy. It means learning how to work with your body instead of against it. The goal is not perfection. The goal is consistency. There is also an emotional side to this that matters. Many seniors feel frustrated when health advice keeps changing. One day something is good, the next day it is bad. That is not what is happening here. The food has not changed. You have. And that is not a failure. That is biology. Once you understand that, nutrition becomes less confusing and more respectful of your experience. Let me ask you another question. If a small change in how you eat one common food could reduce daily stress on your heart, would it be worth making? Most people say yes once they understand the why. Knowledge turns fear into confidence. This is not about obsessing over every meal, it is about awareness. When you know better, you do better naturally. You begin to see food as information for your body rather than rules to follow or break. That mindset alone improves health outcomes. So, if you remember one thing from this video, let it be this. Fruit is not the problem. Eating fruit alone after 60 is. Pair it wisely, and you transform a hidden risk into a supportive habit. That is the kind of adjustment that protects your heart quietly, day after day. If this information helped you, I encourage you to share it with someone you care about. Many seniors are unknowingly stressing their cardiovascular system while trying to do the right thing. Awareness spreads protection. Your heart has carried you through decades of life. It deserves thoughtful care, not fear. And sometimes the most powerful changes are the simplest ones. Stay curious, stay informed, and stay kind to your body. It has been working hard for you for a very long time.